people are referred through to our team, and they may be referred specifically to me, or they may see a nurse first who does all she can with medications, refers on to me for the diet part. I'd expect to see somebody maybe up to about 4 or 5 times, depending on the amount of information required, the amount of support.
One patient to benefit from the community diabetes service is 70-year-old Meredith Crookes, who suffers from type 2 diabetes and now attends her local surgery for regular diabetes checkups.
My mum was diabetic, but she was a full-blown diabetic. And she used to have to go to Almshire Hospital every time. Well, now you see, I can just get on bus, just go down to Newfield Green, and I'm there within 10 minutes. I'm not having to chase up to Almshire or Northern General.
Having a community-based team means that patients have much easier access to a range of services, including sessions with a specialist dietitian, who can give advice on how their diabetes can be controlled through sensible, healthy eating.
Well, they'd have access to a diabetes specialist nurse, a diabetes specialist dietitian, as myself, a podiatrist who's a specialist in diabetes as well. And through that team working very closely together, it's easier, because we're in the community, to refer between ourselves and keep very up to date about how that one patient's care is going and provide a more seamless service across the different professionals. My input would come when they've perhaps had diabetes for some years and the medication they're on needs changing. They're on higher levels of medication and maybe they're considering going to an injected therapy to help control their blood sugars. At that point they need a bit more in-depth information about diet, and I'd go through a lot of the healthy eating aspects of diet with weight control and healthy diet for your heart, but also look at more specific aspects of the diet, such as portion control around carbohydrate, because carbohydrate is the food that puts blood sugar up, and often people aren't aware of the impact of varying quantities of starchy foods and fruits and how that can affect the blood sugar and how it interacts with the dosage they need of different medications.
They give me a chart of all what I could eat and what I couldn't eat. I cut my sugar out. I used to have 2 sugars in my tea. I don't know how much sugar on the cornflakes, but I don't have any of that now.
No one would expect everyone to be a success, but I think by small specific changes tailored to an individual needs, we can make a big impact on diabetes in our patients.